Broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to our February Dementia Dialogue entitled Advocacy and Medical Providers. My name is Heather Mulder and I'm the Outreach Program Manager at Banner Alzheimer's Institute. I will also be the facilitator of this discussion today. So I want to welcome all of you. In our 2018 series, we've made a few changes to how we handle our webinars, and we really are on a pursuit of answers this year. Before I get into more details with that, I do want to go over a bit of housekeeping with you. This session is being recorded, and it will be posted on our website within 48 hours of the end of today's broadcast for future reference. We do have the ability to take text questions from you throughout the presentation today. If there is time, we will address them at the end of the session. However, if there isn't, we'll be sure to follow up after today's broadcast with you with some resources and answers for you. So as I mentioned, 2018 Dementia Dialogues, we are posing difficult questions that caregivers often run into. And so the question that we're addressing today, how can I ensure my person receives the best possible medical care? Which I know this is an issue from many different angles that caregivers and care providers often run into. So I think this is a very timely and important topic, and I'm very excited to introduce our panelists today, Dr. Michelle Grigadis. Dr. Grigadis is a nurse practitioner at the Banner Alzheimer's Institute, certified by the American Nursing Credentialing Center as a family nurse practitioner. She's a certified neuroscience registered nurse. Dr. Grigadis received her master's degree from Creighton University and completed a doctorate of nursing practice at Arizona State University. She has served as an adjunct faculty in the School of Nursing at Creighton University and worked in both the departments of neurology and psychiatry. Dr. Grigadis specializes in non-pharmacological interventions for use in agitation and neurological care of the elderly. She's given presentations at the regional, national, and international level with positive evaluations. Dr. Grigadis, thank you so much for sharing some of your time and your expertise with us this morning.
Well, thanks for having me, Heather.
So I wanted to start this discussion right at the beginning and have a conversation about why are we even having this conversation. I think sometimes care providers, we assume that when we go and see a medical provider, that they're the expert. And so why do we need to be an advocate for our person when we're going to see an expert already?
Well, there are a couple different reasons, actually. So this conversation, of course, as you know, we're having all over the country, and primarily because as a country, in terms of demographics, we are aging. Alzheimer's disease and related dementias are primarily diseases of aging, so they're seen more commonly now in the healthcare arena. Healthcare itself in this country is changing as well. Frequently, insurers or the third-party payers that that pay for the care that we receive commit to different networks, and this can limit options related to providers. Typically, insurance products change annually, so the provider that you see this year may not be in the network next year, which becomes really difficult for folks. Providers leave the networks frequently as well. So you could be in a network and you're, happy in an office and that provider leaves. So change is really the constant in our healthcare system right now. And as we know, probably one of the most difficult things for folks with dementia is change. So the constant then becomes the caregiver. And that's why they become the advocate for the person, for their loved one. An advocate is actually a person defined really as a person who pleads on someone else's behalf. And that's really what we have to do. And that's what we're going to talk about this morning. What is the best way for you to convey your loved ones and your needs, right? Caregivers have needs as well, to the providers.
Mm-hmm. Well, and I think you make a lot of good points. I think advocacy is something that sometimes catches caregivers by surprise. They don't realize that's going to be part of the role that they're taking on.
Oh, absolutely. Absolutely. Because the expectation is the healthcare system is going to take care of us. And the other sort of kind of constant in the Western medical system is that it's very fragmented. So you may have a fabulous primary care provider who's very knowledgeable about your loved one and their disease in terms of their dementia, but they're going to send you to a cardiologist that may have no idea.
Exactly.
So it becomes really fragmented.
Mm-hmm. And I think sometimes there's this perception with medical providers too that you are the expert, and you hence should be the expert in every condition that's walking in your door.
Correct. And that's not correct, right? I mean, what happens is while even some of the specialties that deal with dementias may not be knowledgeable about kind of an atypical dementia. So unfortunately, it becomes kind of the responsibility of the caregiver to be as knowledgeable as they can and convey what's best for their patient to the provider. You know, medical education is changing over time, and you know, some providers who are maybe at the end of their career had little to no education about dementias or any of the neurodegenerative dementing disorders. So, you know, levels of knowledge, it's like everything else, right? There's levels of knowledge vary based on where they are in their practice, what their specific practice is, and to be quite honest, what their interest is.
Mm-hmm. Yeah, I think you bring up some interesting points, how the education is changing, and perhaps providers who have been in the field for an extended amount of time haven't had this sort of experience. So
exactly.
we've established that there's a need, that we're going to need to advocate to our medical providers, and especially if I keep getting back to that perception that this person is supposed to be the expert. And so sometimes it's really hard for caregivers to know how to step forward and say, no, actually, it would be better if it happened this way. Do you have any strategies for how they could avoid maybe ruffling the provider's feathers, if you will, if they have to then correct how they're interacting with someone?
Sure, absolutely. You know, I think the old saying, prevention is worth a pound of cure, is pretty applicable here. There are some ways to let providers know about your loved one's diagnosis even before you arrive. You know, so I counsel folks that, you know, for example, if it's a new appointment with a new provider, you know, now there's a lot of technology out there. A lot of these practices use these portal systems or email where you complete a lot of information electronically before you ever go into the office. So I really encourage folks to use those systems. A lot of these portal systems have different comment sections where you can indicate very specifically, you know, my loved one has Alzheimer's disease in the moderate stage, or my loved one has Lewy body dementia or frontal temporal dementia, or whatever it is. And you can add specific, you know, he or she doesn't like being, you know, they don't like being touched, or you have to speak very slowly, or they don't speak, or whatever your, you know, specific concern might be, and convey that via these technological systems that they're using anyway. You can, if you know, if using technology is just not kind of your bailiwick, then you can write a letter ahead of time and mail that to the practice with your specific concerns regarding communication strategies with your loved one, because you know your person, right? Nobody knows them more than you do or better than you do. So there are ways that you know that they can accept hearing something or not. And so if you have those strategies, convey that in a letter And then I would call ahead of time and make sure that's actually been received. Also, when you're making your appointment, ask about specific options in the office. You know, a lot of, particularly in these, you know, for folks who have this managed Medicare programs, a lot of these practices now have, they call them health coaches within the practice. And so what they do is they kind of help with communication and things like that. Or so to find out, do they have these folks in their practice that you can meet with perhaps before the visit to convey the information, or if you can maybe have a telephone conference with, or something like that. Also, if they don't have those, you can ask to speak with perhaps set up like a time to have a phone conference with an ancillary staff member. You know, maybe the nurse, if they have a nurse in the office, or the medical assistant that works with a specific doctor or provider that you're seeing, and talk with them, right? So sometimes I wouldn't say it's realistic to expect to be able to speak directly with the provider before you go into the office for a new patient, but it's not unrealistic to expect to be able to communicate with one of the ancillary staff members. And then the expectation would be that MA or that nurse would convey that information to the provider before your loved one was seen. So for the new patients, I encourage people to use those sorts of strategies. For an existing provider, right, somebody that you've seen all along, but you know, maybe you have been a little intimidated or didn't want to say anything to them, but now you're feeling like, you know, no, it's time to do that. I always tell folks it's best to request the best method to communicate before your appointment. So call the office and ask them, I really need to say some things to provider X, and let them know what is the best way. And they'll convey that to you. They'll say, you know, well, why don't you shoot us an email, or, you know, write a note to them or whatever, and then convey whatever it is that you need to convey. I will tell you, I work in specialty, right? I see people with dementia every day, and frequently people will, I ask them to write up whatever they need to tell me and bring it when they come in. And then I look at it briefly before I see the patient. Now, mind you, I know the patients already, so that bringing it in right before likely is not going to be helpful in primary care, because if you think about primary care, you know, how long are you in that office? You might be in the office for an hour, but you're only seeing that provider for maybe 15 minutes. So you'll want to make sure that they have the information that you want to convey long before your appointment. And I think that, so that's what I would say about trying to prevent things. Now, if you're in the office and you're feeling like, you know, the provider's kind of ignoring your person or not engaging them, or telling them, you know, giving information that is not understandable or too quickly, I suggest that people, versus saying to the provider, listen, you need to slow down, perhaps say something like to the loved one, you know, he's wanting you to take your blood pressure at home, and what do you think about that? What would be a good time? So this is kind of a way to engage them in the conversation, and also kind of a little, it's not necessarily nonverbal, but it's going to stop the provider from speaking, right? So it'll give them, it'll slow the conversation down, and it will engage your person. Or something like, you know, she wants you to change your diet, and what kind of fruits do you think we should get at the store? You know, that's going to do the same thing. It's going to it's going to engage your person, and it's going to demonstrate kind of non-verbally to the provider, you know, you got to slow down. They're not understanding what's happening.
Oh, I think those are all great, great strategies, Dr. Gregatis. I think, like so many things, as a caregiver of someone with dementia, we are always encouraging people to be proactive. What can you anticipate ahead of time, and how can you try to avert those problems, avert those crises before they ever become crises? I had no idea about the health coaches, or potentially tapping into a portal system to write comments, or going the non-technological route, writing a letter to the provider ahead of time. So I think those all can be very useful strategies. I want to move on to our next topic of discussion. I know sometimes as caregivers we hear that maybe not everything that is being offered to your person is going to be necessary for them. Do we need to add in that multivitamin that this provider is recommending? Can you offer any advice to our listeners about how do they discern what is going to be necessary medical care for their person? How do they know what's best and what's actually needed?
Yes, that's a really common conundrum, actually. It's really a tough question, and actually it's quite specific to each patient and family. So what I tell families and patients is that really, to the question, what is necessary, comfort and dignity are necessary. Everything else is negotiable, right? So because this disease is, unfortunately, this is a terminal disease, right? And so if you think about other medical care in that context, sometimes that helps. If you think about, for example, healthcare providers historically have been just completely focused on curing things, right? That was the goal, and to intervene at almost any cost, right? So to not cure something becomes very difficult for some providers, particularly those that are in mid to late career, because that was kind of the paradigm of medicine. We must cure things, and that may not be what you as a caregiver or your loved one wants. So frequently determining whether or not you choose to do something or take something really kind of depends on the stage of the disease that your loved one is in. For example, a medical intervention may be different in the mild stage of a dementia versus when somebody is in hospice, right?
Right.
You're much less likely to do something towards the end of the disease than you would be in the beginning. A common question I get is about preventive care, right? Colonoscopies, mammograms, those kinds of things. And those are really common, right? You go into primary care, they will every 5 years say you need to have a colonoscopy, regardless of anything else that's going on in your life. And so again, if we go back to comfort and dignity are necessary, a colonoscopy is not comfortable. Not only is it not comfortable, it requires the use of some sedation, and it can cause a lot of confusion. But at the end of the day, what I tell people is a good kind of premise is there's no need to ask the question if you're not going to act on the answer. And what that means is colonoscopies look for colon tumors. So I say to people, okay, if you have a colonoscopy and there's a tumor, what are your thoughts? What would you do? And if the answer is, well, I would do nothing, then there's no need to look for it, right? There's no need to go through that process if indeed you've decided you wouldn't do anything about it. Same thing with a mammogram. Mammograms are uncomfortable, as all the women in this conference will know. But if you have a dementing disorder and your ability to maybe articulate or speak about things or identify things is impaired, a mammogram is awful. It's frightening. It's uncomfortable. you may not be able to, it's just, and again, if you had breast cancer and you were mid-stage or later in the disease, and your loved one and your caregiver wouldn't treat that, then there's no reason to have it. So in terms of the preventive care, that's really, you need to look at what is the purpose of it, and is it something that you would do something about? And many people would do something about it. So in that case, it's appropriate to do. But you really have to ask yourself, what are you going to do with that answer? Same thing with medication. I see a lot of people who are on simvastatin, or the different statins for high cholesterol. Mm-hmm. Same thing. The purpose of those typically is to prevent stroke, over a 7 to 10 year period. So you need to sit down and have a really healthy discussion with your primary care about what are all of these medicines that I'm taking? What do they do? What is the goal? And thinking about this disease as a terminal disease, is this something that, we want to continue? And a multivitamin doesn't sound like much, but when you're having difficulty swallowing and you're taking 10 different pills, right, that's just another burden. And so those, I strongly, usually what I do when people come in is I go through and I look at all the medicines and I say, well, you might want to ask about these medicines. Go back to your primary care and I check off for them. Talk to them about these, because maybe this is something you may not need to do. And that's kind of my suggestion, because again, some families will feel very strongly, and their loved one conveyed to them that they wanted very specific things to happen. And mm-hmm. then other families, the opposite. Their loved one conveyed early on that they didn't want these things. So it's important that we honor what our loved one wanted.
Mm-hmm. And I appreciate that reminder, because sometimes it's hard when you get in the moment, even if you've had that discussion, when it comes down to that actual moment, sometimes it can be hard to make that decision.
Absolutely, particularly when you have caregivers, or care providers saying to you, well, this is standard, this is what needs to happen. Right. Well, no, it's not, because what needs to happen is comfort and dignity. Everything else is negotiable.
Perfect. Another issue that I hear a lot from caregivers is when they're coming to a doctor's appointment, and the provider can be fantastic and be addressing the person with their questions, and the person says, oh, everything's fine. Oh, no, I'm just fine. And then the caregiver is sitting in the background shaking their head and saying, oh my gosh, how do I tell them everything's not just fine? Do you have any strategies how you can disclose information that the person might not be able to handle?
Sure. Typically the same strategies as communicating earlier. Use those same methods. I would check with the provider's office to find out, particularly most folks, you can develop a relationship with primary care, but in the event that you can't, find out from the office, how can I convey information that they need to know before we come in? And if that's email or letter or whatever that is, use that method to convey the specific behaviors or specific issues for that appointment beforehand.
Okay.
And then the provider will have that information. Now, that part's easy. The difficult part is I run a few support groups, and it's interesting because I just recently had someone in the Lewy body support group, the family, they were livid because they said to the provider, this is, my husband has Lewy body dementia and blah, 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 and you need to know this. And that provider was kind of rude and said, I'm not going to ignore, they're my patient and that's who I focus on, and et cetera, et cetera. And while that is true, right? The responsibility for a provider is to the patient that they're seeing. As we all know, in this disease, this is a shared disease. So my suggestion to folks is don't argue, don't argue with the person, because that's just really going to kind of make things worse. And perhaps if it's a specialist, get some info, ask the primary care person to convey something to them to kind of bolster your argument, or go back after the visit and say, okay, this is, because typically what happens is the patient will say, I'm perfectly fine, I don't have chest pain, et cetera, et cetera. This particular provider happened to be cardiology, and so the cardiologist ordered all these tests, and the person said, he can't do these things. And they didn't listen, and so they, were doing a stress test, I think, and said, go ahead and walk on the treadmill, and of course, and stop when you're done. Well, of course, he stepped off in like less than 30 seconds because he couldn't process. So then it became evident, and then the provider then apologized and was much more open. But so that's something to address too. Don't argue with the person, and then afterwards try to convey different information. And if it comes down to where they're just not going to be a good fit, then you go to a different provider.
Okay, perfect. And again, sometimes it's hard to know how to approach that provider. And it's unfortunate that even when the caregiver does ahead of time, that sometimes providers don't listen. But
Correct.
I think the being proactive is the important part. We just have a couple minutes left, Dr. Grigatis, and I want to jump to our last question, because I know this is another huge one that especially the folks at our front desk run into. So you've laid the groundwork, you've filled out all the paperwork to get an appointment. Now the day comes for the appointment and your person says, I'm not going to the doctor. Do you have any strategies for how to get a person to their medical appointments?
Sure. So a couple things. We have what's called anticipatory anxiety, meaning folks with dementia tend to kind of perseverate on things. So you don't talk about it. You don't talk about it until the morning of. You don't talk about it a week before and say, okay, you're going to go see Dr. X next week, because that can cause some problems. So the morning of, if they're in the earlier stage, you kind of couple it with a pleasant experience, like, okay, we're gonna go and see Dr. Smith this morning, and then we're gonna go to that fabulous pie shop next door and have coffee and pie, right? Or whatever is pleasant for your loved one. I think that you need to allow extra time to prepare. Look at what is the best time of your person. If the best time for your person is in the afternoon, really try to get afternoon appointments, and vice versa. Allow ample time, use the senses so that you're making the whole day kind of pleasant. So, if your loved one is a coffee drinker, you wake them up in the morning, maybe set a cup of coffee near the bedside table so they can smell that coffee, and maybe music. So you're using those senses. You open the drapes and maybe, sing or do something that makes this a happy, pleasant day. And this doctor's appointment is just a piece of that. The only other thing, if you were going to a dentist or something like that, you may want to look at getting some medication to kind of help with maybe calming people down before that. But typically just, making this either a fabulous experience or, kind of not a big deal on your way to a really nice experience.
I love that. I think sometimes as caregivers, we build these things up in our head. I know my person is not going to want to go to this. And then that energy transfers to the person, and then you're met with resistance, and it just becomes this cycle. So I love the idea of making it a whole day event, and this is just one piece of it. Dr. Grigatis, I want to thank you so much for giving us a little window into what goes on in the minds of different providers. I think this has been really helpful information, And I appreciate how you've boiled it down and just made things very simplistic for us, reminding us that change is the constant in the medical community. An ounce of prevention is a pound of cure. So how can we reach out to them ahead of time and provide them with important information to make this successful? The reminder that comfort and dignity are really the touchstones. They're the touchstones of what is necessary in medical care. I want to invite everybody to join us again next month on March 21st, where we're going to have one more month where we're looking at advocacy. This one is going to be stigma, advocacy, and awareness, where we're going to ask the question, what is being done to make communities more dementia capable for people and families? I want to thank you for joining us this morning. As a little bit of housekeeping at the end of our session today, I do want to mention that at the close of our session today, you will have an evaluation that is emailed to you. Please do take a few moments to fill out that evaluation and let us know what you thought of today's session and if there's any other topics you'd like us to address. I'll remind you as well, our session has been recorded and it will be posted on our website for future reference within the next 48 hours. Thank you so much for attending Dementia Dialogues, where we bring the dementia education to you.